Patients with hypermobility syndromes like hEDS or HSD are at increased risk of craniocervical instability or CCI, which occurs when there's slipping of the bones at the craniocervical junction where the skull meets the spine. This can be a result of trauma, but there's also emerging data to suggest that CCI can be triggered by hyperextension of the neck performed during surgeries or dental work like wisdom tooth extractions, nasal and sinus surgeries, and surgeries requiring intubation or a breathing tube. Even minor positioning in the dental chair or during intubation can cause lasting headaches, visual snow, brain fog, dysautonomia, and neck instability, which is often described as a bobblehead type of sensation. CCI can also be especially hard to diagnose because it's usually missed on a typical MRI. Most cases require dynamic MRI or CT to observe the slipping during movement. Not only that, but CCI can be incredibly hard to treat once it starts, so preventing it is really, really important. So here are the tips that I give my hypermobile patients that are preparing for surgery or dental work. First, make sure to discuss this concern directly with your surgeon or your dentist, as well as your anesthesiologist before your procedure. Everyone involved in your care should be made aware of your increased risk of CCI. Bringing supporting documents to this discussion can also be really helpful. Things like a letter from your primary care doctor or your hypermobile specialist if possible, or even primary literature like this case series, which I'll link in the description below. If it makes sense for the procedure, I also highly recommend bringing a hard cervical collar, like the Miami J for example, and wearing it during the procedure. This collar physically blocks hyperextension of the neck, so it's the most reliable way to prevent perioperative CCI. Make sure to bring the collar with you to any preoperative visits and make sure to discuss it with your surgical and anesthesia teams well ahead of time. Don't let a routine procedure derail your health. Save this, send it to your care team, and follow for more.